My name is Peter Sundström and I work as a neurologist, a consultant in neurology up in Umeå in northern Sweden, and I'm an associate professor in neurology as well. I think the data from the SOLAR study presented this morning by Professor Huppert was the most interesting so far at this year's ECTRIMS, and this was the first of a series of larger randomized controlled trials of vitamin D supplementation in MS, and there are another 5 studies pending. And in the SOLAR study they found that vitamin D supplementation decreased the risk for inflammatory activity on MR with about 30%. That was statistically significant, and a similar, although not significant, effect on relapses was present also. And this they found even though all patients were on a high dosage of Rebif. So to my mind, these findings add strongly to the rationale behind vitamin D supplementation in MS. So the SOLAR study compared the effect from vitamin D supplementation against placebo in a population on Rebif, and the dosage of vitamin D was I would say very high, 14,000 international units every day. I commonly use 2,000 units per day in my patients, which is most often enough to reach serum levels of 100 nanomoles per liter. Yeah, but this high dosage was used, and this was originally planned to be a 2-year study on 350 patients with MS. Unfortunately, they had to shorten the study to 48 weeks and also to reduce the number of patients to 229. So this study was clearly underpowered to detect an effect on relapses or EDSs, and the primary endpoint, NIDA, was not reached. But the effect on MRI, on MR inflammatory activity, was found even though MR was only performed twice, in the beginning and at the end, in the end of the study, meaning that lesions arising just a short time after study onset were counted, and that may have underestimated, as I see it, the effect from vitamin D supplementation in this study. And you cannot read these results in such an investigator-driven study with the same eyes as you use when you read pharma-sponsored studies. I guess this study illustrates many of the problems with investigator-driven studies, and to my mind this is a positive study where the lack of a positive effect on the primary endpoint mainly is because of lack of power. Thank you.